Hi, I'm Nurse Carol. Let me start with something that may surprise you. After 75, the blood pressure number the whole world calls perfect might not be perfect for you at all. So pour yourself a cup of tea, get comfortable, and let me explain, because this is something I wish every older woman knew. If your doctor recently told you your blood pressure is a perfect 120 over 80, I'd like you to sit with me for a few minutes, because for some of us, once we're past 75, that number the world calls perfect may not be the whole story. And what I want to talk about isn't high blood pressure at all. It's blood pressure that's been pushed a little too low. I know that sounds surprising. For years, we've all been told lower is better. And for many middle-aged adults, keeping blood pressure well controlled is genuinely important. But our bodies change as we age, and the number that's right for a healthy 50-year-old isn't always the number that's right for someone who is 78, with other health conditions to consider. Now, please hear me clearly right at the start, because this matters more than anything else I'll say today. I am not telling you your reading is wrong. I am not telling you to change or stop any medication. Please never, ever adjust your blood pressure medicine on your own. What I'm hoping to do is simply help you notice something and bring it to your own doctor. Let me explain why the target that's right for a younger person may not fit an older one. The well-known blood pressure goals were built largely from studies of healthy middle-aged adults. And for a long time, those same goals were applied to people in their 70s and 80s without much adjustment. More recently, researchers have begun studying people over 75 on their own, real patients with diabetes, with heart conditions, with a history of stroke. And some of that work suggests that for the oldest and frailest among us, pushing the pressure very low may carry its own risks, more dizziness, more falls. It's an area doctors are still learning about, which is exactly why the right number should be decided by your doctor, for you, not by any single rule. Let me explain 3 gentle changes that happen inside the body as we grow older, because together they're the heart of this. First, our blood vessels stiffen. When we're young, they're like soft, springy rubber tubing, flexible, easily expanding and relaxing with each heartbeat. As the years pass, they grow stiffer, like a garden hose left out in the sun. An older body sometimes needs a little more pressure to push blood all the way up to the brain and out to the kidneys and the legs, against gravity. If the pressure is pushed too low, the brain may not get quite enough, and that can show up as a foggy head or dizziness when you stand. Second, the body's pressure sensors respond more slowly. In the walls of our blood vessels sit tiny sensors like little speed detectors, whose job is to notice the moment blood pressure changes and tell the heart to adjust. In a young person, stand up and the body corrects in a heartbeat. After 75, those sensors are slower. You stand, and for a few seconds the pressure dips before the body catches up. That's the dizziness. And if you happen to be on the stairs or walking to the bathroom at 2 in the morning in the dark, that's when a fall can happen. Third, the liver and kidneys clear medicine more slowly. The very same pill can build up a little more in an older body and act more strongly than expected. So the pressure may drop lower than the calm number measured sitting still in the clinic. You may feel perfectly fine sitting down and quite different the moment you stand up. Let me tell you about someone, not one real person, but a picture drawn from many I've cared for. I'll call her Lan, 76, living with her daughter, out to the shops early each morning, going to her checkups faithfully. Her pressure in the clinic read a bit high, so her doctor started one small tablet, then later added another, and the number came down nicely. Everyone was pleased. But around then, Lan noticed something. Every time she stood up from the table, her vision would darken for a second or two. Every morning, getting out of bed, she had to hold the bed frame and stand still a moment. She mentioned it and was told, gently, that this was simply age. No one measured her pressure standing up. No one knew that her lovely sitting number dropped sharply the instant she rose, and one evening, getting up in the dark so as not to wake her daughter, she fell before she reached the door and broke her hip. No one meant any harm. Her doctor followed the guidance. The medicine was properly prescribed. It's simply that the whole picture, the real person, standing up in her own home, hadn't yet been looked at. And that is the one thing I'd love to help you look at today. So let me show you a gentle check you can do at home. It's often called a standing or postural blood pressure check, and many people never have it done. Yet you can do it yourself with an ordinary home monitor from any pharmacy. Here's how. Step 1. Lie down and rest quietly for a full 5 minutes. No talking, no phone, just resting. Step 2. While still lying down, measure your blood pressure and write down both numbers, the top and the bottom. Step 3. Stand up and within a minute or two of standing, measure again and write that down. Step 4. Compare the two. If the top number falls by more than about 20 points when you stand, that's worth paying attention to. If the bottom number falls by more than about 10, that's worth noting too. Let me give you a simple example. Lying down, someone reads a comfortable number. Standing up, it drops sharply, a big fall in the top number. That lower standing number isn't just a few seconds of dizziness. It can mean the brain is running short of blood the whole time you're up and about the house, and that's what raises the risk of a fall. If your own check shows a big drop like that, take that piece of paper to your doctor. And don't wait for your usual appointment. Now, I want to be very clear about the numbers because this is where I have to be careful with you. I am not going to give you a target blood pressure to aim for because the right number is different for every single person. It depends on your age, your other conditions, how steady you are on your feet, and the medicines you take. That is a conversation for you and your doctor, not for a video. What I can tell you is this. It is completely reasonable to ask your doctor, for someone my age, with my health, what blood pressure target is right for me. A good doctor will welcome that question. Let me show you why the same number can mean two different things. Imagine two people, both 81, both with the very same reading. The first has a weak heart, kidneys that have struggled for years, sore knees, poor sleep, and morning dizziness. The second still rides his bicycle each morning, sleeps well, cooks for himself, and has no major conditions. Same age, same number, yet they may need quite different plans. For the frailer person, two strong medicines might bring a real risk of dizziness and falling. For the more robust one, gentle changes, less salt, a little more movement, might be plenty. This is the whole point. We treat the person, not just the number. And the one who understands your whole health best is you. I want to say something kindly here, and not as a criticism of anyone. Your doctor isn't at fault. They're following the current guidance, and a single visit is short. There's a great deal to cover in 10 or 15 minutes, which simply means that you, at home, over many days, can gather something a single clinic reading can't, the fuller picture. That's not working against your doctor. It's the best gift you can bring them. Let me ask you gently, do any of these feel familiar? Standing up from a chair and needing to grab the arm for a few seconds. Getting out of bed and having to stand still until your vision clears. Rising from the table and feeling lightheaded, your sight blurring for a moment. Or simply feeling unusually tired or foggier than you used to. So many of us nod along and think, well, that's just old age. Sometimes it is. But sometimes it can be a sign the pressure is running lower than the brain would like, even when the sitting number in the clinic looks perfectly fine. If you take blood pressure medicine and you notice any of these, please don't stop your medicine. But do tell your doctor and be specific. Not, I feel a little dizzy, but every time I stand, I'm dizzy for several seconds, and here are my home readings. Real numbers change the conversation from a vague feeling into something your doctor can act on. So let me leave you with a few simple, doable steps. First, if you don't have one, consider a simple home blood pressure monitor. The arm kind is fine, and most pharmacies carry them. It may be one of the kindest things you buy for yourself. Second, measure morning and evening for 2 weeks at about the same time each day, after resting 5 minutes, and write every reading down. 2 weeks of readings paints a far truer picture than one measurement in the clinic. Third, tonight or tomorrow, try that gentle standing check. Lie 5 minutes, measure, stand, measure again. Fourth, look back honestly at your symptoms, the dizziness, the tiredness, the foggy moments, and write them down, even if you were once told it was just age. And fifth, book a visit with one clear purpose: to talk about your own personal blood pressure target. Bring your diary, bring your standing check numbers. You are not a passive patient waiting to be told. You're the person who knows your body best, and you have every right to be part of the decision. In all my years in healthcare, the thing I've seen most often isn't some rare, unstoppable illness. It's falls. The person up at 3 in the morning. The one who stood from the table and went straight down. And so often, just months earlier, their pressure had been praised as beautifully controlled. So many of these falls could be gentled if we look at the person and not only the number. And if you're watching this not for yourself, but for a parent or grandparent on blood pressure medicine, here's what I'd ask. Next time you take them in, bring this question. For someone their age, what blood pressure target is right for them? And should we check it standing up as well as sitting? That one question can make a real difference. And if your loved one has dizziness on standing or unusual tiredness, please don't settle for "it's just old age." Ask again. Sometimes the best protector of an older person's health isn't the doctor. It's the caring family member standing beside them. Let me gather it into something easy to hold on to. The one-size-fits-all target may not suit everyone past 75. The right number is personal, so ask your doctor what's right for you. Never change your medicine on your own. Try the gentle standing check at home and bring the numbers in. And treat the person, not just the number. Take good care of yourself. You've earned it. And remember, always check with your own doctor about your blood pressure and your medicines, and about anything that doesn't seem right. This is Nurse Carol, wishing you health and peace. I'll see you next time.